Right now what we're going to do is we're going to go over the bony palpations on the posterior aspect of a human, and primarily that really apply to the lumbar spine, but some of them are going to extend down into the SI pelvis and then up a little bit into the lower thoracic, because these are areas that you're going to need to be able to assess and palpate to be able to treat the whole person. And remember that some of these pathologies that you might maybe have to deal with, you're going to have to be able to differentiate, because just because they say their pain hurts here doesn't mean that it's necessarily coming just specifically from their lumbar spine. So the first thing that we're going to start off palpating is their PSIS, so their posterior superior iliac spine. When you think about that, the best way to first find it is to find the crest of their iliac, so that on both sides, so that should be the highest point laterally, and then you're going to follow it back. And as you come down, what you're going to find are two little bumps that are going to sit on either side. And for a lot of people, if you look at them just standing, you're going to see like two divots on the back side or top part of their butt, and that's really kind of what you're looking for. So the PSIS should be on either side, and they should be pretty predominant kind of nodules that you're going to be able to feel. Then once you're on the PSIS, what you can do is just move medially, and you should be on your sacrum. And in the center of that, you should be able to feel a little nodule. And this isn't going to be big like we talk about the other spinous processes. It's going to be pretty small. Like think about a pencil eraser kind of thing, or smaller, and that is S1. And that's going to be important when you're trying to find range of motion, because remember, if we're going to do tape measure stuff or any of our side bending kinds of things, that's where you're going to put the fulcrum of your goniometer, or for the tape measure, that's where it goes. So S1 is an important point, and right above S1 is going to be the base of your sacrum, which is another important point that you're going to need to know when we're doing various tests, and also when we talk about some of the motions, so the rotations and torsions of the sacrum. So from S1, you're going to come up until you feel the next nodule, which is going to be the spinous process for L5. Again, come up a little bit, L4, L3, and you should be able to feel the spaces in between them, L2, and then we get to L1, and these are going to be kind of big. Like your spinous processes for your lumbar spine, they're not itty bitty like what you have up in your neck. They're fairly sizable, so they should be at least as big as one of your fingers. Depending upon the person, they might even be bigger than that. One of the ways to figure out where you're at, and also by the way, once you get to L1, then the next one is going to be T12. And once you get to T12, you're really looking at where the ribs are going to be connecting with that. Now remember that these spinous processes are not equally lined up with the transverse processes. The transverse process here is going to be one finger above where that spinous process is, and then that's kind of where the ribs meet up. So the ribs are going to come around, and you should be able to follow it all the way to that level. So as we do this, another way to check it is if you come off of their iliac crest and you come straight in, so iliac crest and you come straight in, you are either going to be on L3 or L4, or the inner space in between them. On Ann here, I'm in the inner space between L3 and L4, and I know that because I tried it out before we did this video. But to verify that that's where you are, if you're on L3 or L4, what you can do is just count down. So that's where I was. Here's a spinous process, here's a spinous process, and now I'm on S1. So if I'm on S1, L5, 4, 3, and then that's how you can verify. Don't ever just assume when you come in that you're on L3 or L4. You need to make sure that you have a way to verify, and certainly coming down to S1 is a great way to do that. Or if you can find the spinous process for T12, you can really count down from there. When we talk about the transverse processes, a lot of people think, and when I talk about the vertebrae, I say, you know, this is the body and the spinous process and the transverse processes. But in most aspects, and if you look at the disc, the pictures of them, the spinous process is a little bit lower or inferior to the transverse processes. So what you need to think about is find your S1, L5, Your L5, when you look for those transverse processes, are going to be just a little bit superior to the spinous process. Now, when I say a little bit, I mean really like just a little bit. So we're not looking inches above it. And the way that you're gonna find it is you're gonna be here and then come out, and you should be able to push on one side. So unilateral kind of downward rotation, and the opposite side should come up towards you. So if you do a posterior to anterior push on the right side, then the left side should come backwards. And as you work up, you should be able to feel the same thing. And also these transverse processes are pretty wide. So you're gonna need to be like 2 inches out from the spinous processes minimum, okay? When we talk about the sacrum, we already started talking about it. Number one, when you're gonna palpate anything in this general region, make sure you're explaining what you're gonna do to the patient. She already knows what I'm doing, so I'm not gonna take the time to do it, but just make sure that you explain to them where you're gonna be touching, what you're gonna be doing, and that if they're uncomfortable, that they need to let you know. And so, again, you can find their PSIS, so those nodules come just to the inside, and now you're on their sacrum. Their sacrum, and again, confusing, the very superior portion of it is the base, okay? So it's basically an upside down triangle, and it's gonna come down, and so the main part of it is almost a square that then ends in a point. And so when you're on the sacrum, you should be able to feel the 4 corners of it, and it really has 4 corners, I promise. And so you should be able to palpate straight down the side and find the corner, and then on the opposite side, palpate down and feel the corner. And when we talk about some of the rotations, these are the corners that we're talking about that are going to be flipping around the axis. Being able to find this inferior lateral corner on either side and the superior lateral corner on the other side, you should be able to palpate both of these fairly easily. You should also be able to palpate the spinous processes. So again, finding your PSIS, coming to the inside, spinous process, and you should be able to palpate minimum the top 3, and then the others start getting smaller and smaller. Do not push crazy hard because it hurts your patient, and also it's not going to improve your ability to palpate them. So that's the sacrum. And then the coccyx gets a little bit closer to things that people are careful about. So again, make sure that you're explaining things well. But if you can find the 2 corners and you come to the middle, the coccyx is just going to be lower than that. For the purposes of this class, we are not going to be doing coccygeal palpations, but you should know from an anatomical standpoint where it is. And if they're complaining of pain in the center, pretty low, close to their anus, and they fell really hard or got hit really hard, chances are they broke their coccyx. By the way, it doesn't heal super good, and it's not awesome for the people when that happens. So again, coming back and finding the borders of the sacrum are gonna be important because the sacrum and the ilium come together to form your SI joint. So remember we talked about the PSIS. The PSIS is the beginning or the superior portion of the SI joint. So what you would do is find these, and if you roll inside, you should be able to feel the sacrum just deep to that, and that is the beginning of your SI joint. And if you ask them to move their hips, so go into extension a little bit, you should be able to feel the ilium move as well as the sacrum move. What else do we need to talk about? Ischial tuberosities. These are going to be important for the back, for the pelvis, and for the hip. The best way to palpate the ischial tuberosities is pretty much find their glute fold, and again, explain what you're going to do before you do this. But this is the main origin, or the actual origin, for all of your hamstrings minus the short head of your biceps femoris. And so what you're going to do is I just come from the bottom and then push deep and then come up, and you should feel a nice hard rounded bone. That's your ischial tuberosity. And a lot of people just call it their sit bone, but if you push on it and then if you ask them to like flex their knee, as soon as they do that, you should start feeling the hamstrings contracting. It's kind of difficult from there to be able to differentiate between the 3 hamstrings, but at the very least, you should be able to feel all of them contract. SI joint, sacrum, yeah, I think that is all of our bony prominences on the posterior side.